Before you take your supplements this morning, there is something important you need to understand. Many of the most common vitamins people over 60 take every single day are not helping the body the way most believe. In fact, in certain forms and doses, some of them may slowly work against long term health. At the same time, research points to several nutrients that are strongly connected to healthier aging: stronger bones, better brain function, deeper sleep, and in one case, a dramatically lower risk of early death. By the end of this video, you will know which supplements may be doing more harm than good, which ones are worth prioritizing, and why the difference becomes more important as we age. And make sure you stay until the end, because the final nutrient combination may be one of the most powerful tools for long-term health after 60. Aging changes how your body handles supplements. Here's something most labels never mention. The body at 65 is not the same body it was at 40. The liver processes nutrients more slowly. The kidneys clear waste less efficiently. The digestive system absorbs vitamins differently. And nerve tissue becomes more sensitive to excess. That means a supplement that once felt harmless can gradually become problematic. Not because the vitamin changed, but because the body did. And this is where many well-meaning seniors unknowingly create health issues while trying to stay healthy. Let's begin with the first common vitamin that deserves caution: vitamin A in synthetic form. Vitamin A supports vision, immunity, and skin health. But the problem lies in the form found in many multivitamins. Most supplements use synthetic retinol or retinol palmitate. Unlike plant-based vitamin A, retinol is stored in fat tissue and the liver. As the body ages, it clears this form much more slowly. Over time, levels quietly rise. Elaine, age 68, took a senior multivitamin for several years without a second thought. Gradually, she developed dry skin, aching joints, and frequent mental fog. Blood tests later showed unusually high vitamin A levels. Studies have linked elevated retinol levels in older adults with increased heart rhythm problems and higher fracture risk. The safer form of vitamin A comes from foods like carrots, spinach, sweet potatoes, and other colorful vegetables. This form, beta-carotene, is converted by the body only when needed. Excess is not stored dangerously. Many health experts recommend avoiding synthetic retinol unless specifically directed by a doctor. Iron supplements without deficiency. Iron is essential, but only when the body truly needs it. After menopause and later adulthood, most people no longer lose iron regularly. The body has no efficient way to remove excess. So when iron is taken daily without deficiency, it builds up in organs such as the liver, heart, and pancreas. This buildup increases oxidative stress, a process that accelerates aging and inflammation. Samuel, 72, took an iron-containing multivitamin for years. Fatigue and joint discomfort worsened over time. Tests eventually showed iron overload. Research has linked excess iron in older adults with higher risk of heart disease, memory decline, and organ damage. Doctors now commonly advise seniors to avoid iron supplements unless blood tests confirm low levels. High-dose calcium taken alone. Calcium is vital for bones, but it does not work alone. As we age, bones absorb calcium less efficiently. Excess calcium that is not guided properly may settle in arteries, joints, and soft tissues. This contributes to stiffness and cardiovascular calcification. Calcium requires vitamin D3 to absorb properly, vitamin K2 to direct it into bones, magnesium to keep it from hardening tissues. Without these, calcium becomes poorly regulated. Health professionals now suggest prioritizing calcium from foods such as leafy greens, yogurt, sardines with bones, almonds, and seeds. If supplements are used, they should be paired with D3, K2, and magnesium under medical guidance. High-dose vitamin B6. Vitamin B6 is often included in energy and nerve supplements at extremely high levels. While it is water-soluble, large amounts taken long-term can accumulate in nerve tissue. This may lead to peripheral neuropathy, tingling, numbness, balance issues, and nerve pain. Karen, 69, took a nerve support supplement with high B6. Instead of improving symptoms, numbness worsened over time. Research has shown increased nerve damage risk with prolonged high-dose B6 use. Seniors only need small daily amounts easily obtained from food. Many doctors recommend avoiding large doses unless medically prescribed. Now let's shift to nutrients that consistently show benefits for aging health. Magnesium, the silent deficiency. Magnesium plays a role in over 300 body processes. It supports heart rhythm, muscle function, sleep quality, blood sugar control, and nervous system balance. With age, absorption decreases, and many medications further drain magnesium. Low magnesium levels have been linked to inflammation, heart rhythm issues, fatigue, and memory decline. Many seniors notice better sleep, fewer cramps, and steadier energy when levels are corrected. More absorbable forms include magnesium glycinate and citrate. Doctors often discuss doses between 250 and 400 milligrams, depending on individual needs. Vitamin D3, far more than bone health. As skin ages, its ability to produce vitamin D from sunlight drops dramatically. Vitamin D3 influences bone strength, immune function, mood balance, brain health. Low levels have been linked to infections, depression, and cognitive decline. One key tip many miss: vitamin D absorbs best when taken with healthy fats like eggs, avocado, or olive oil. Blood testing helps determine proper levels and dosing. Omega-3 fatty acids. Omega-3s help reduce chronic inflammation, a major driver of aging disease. They support heart health, brain function, mood stability, and joint comfort. Studies show links to lower heart event risk and slower cognitive decline. Main sources include fatty fish, such as salmon, sardines, and mackerel. Supplemental fish oil or algae oil is commonly used when diet is low. The powerful vitamin D and magnesium combination. This is where research becomes especially interesting. Magnesium is required to activate vitamin D in the body. Without magnesium, vitamin D cannot fully perform its functions. Large studies have shown seniors with adequate levels of both nutrients had significantly lower overall mortality risk compared to those deficient in one or both. Together, they function as a system, not separate supplements. This combination appears to support bone strength, immune health, heart rhythm, and inflammation control. Final takeaway: 4 supplements. Many seniors should approach carefully: synthetic vitamin A, retinol, iron without confirmed deficiency, calcium taken alone, high-dose vitamin B6, and 4 nutrients consistently supported by research: magnesium, vitamin D3, omega-3 fatty acids, vitamin D3 combined with magnesium. Simple next steps: check supplement labels, ask for basic blood tests, prioritize food sources when possible, discuss doses with a healthcare provider. Small changes can make a powerful difference over time. Medical disclaimer: this video is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult a qualified healthcare professional before making changes to your supplement routine or medical care.